So here we are with a Q&A with Dr. Sherry. I'm very excited about this. I feel like I could learn a lot. I'm excited for all the ladies out there and all of the people who care about ladies out there to learn a lot. So, first question, can you have sex on your period and should you?
Well, absolutely you can, and it's personal choice. It's a little bit messy, but if you don't mind that, you just put a towel underneath you, preferably not white, and it can be a lot of fun. Also, fun female fact is that having an orgasm during your period can help with menstrual cramps.
Maybe I should invest in some black towels then.
I think it's a great idea.
Can your vagina close back up if you don't have sex for a while?
I like to use the metaphor that the vagina is like elastic band of your stretch pants. The more you use it, the tissue gets looser. And if you stop having any of those inside the vagina for months or years, it definitely closes up a little bit, but just a little. It doesn't close permanently.
Okay, well, speaking of tightness of the vagina, can your partner tell if you are a virgin?
Well, let's first really talk about what virgin means, because I think it's the most outdated definition, because when I was growing up, it meant no sexual activity.
For me, growing up, if you say you're a virgin, to me, that meant vaginal intercourse.
But it's not inclusive of our LGBT, Q community. So,
yeah.
To answer that specific question, if you're talking about having sex with a male who has a penis, you can't always assume that either nowadays. How big is his thickness? How big's the girth? How big's the length? Mm-hmm. How often has this woman been using her vagina? So it's not always a tell. Just because you haven't had anything in there and a male partner can actually tell. There are many other factors.
Is it common for a young female to lose her virginity and then continue to bleed after?
Again, it kind of depends on some factors. It's usually the first few times you have something inside the vagina, you will have some bleeding because of that inner hymenal ring that is tight. So if it's once a month you're putting something in there, sometimes you might have bleeding. If it's, you're bleeding every few days that you're having something put in the vagina, that's not so normal. So there are things that you can do, and definitely you want to talk to your healthcare provider, because bleeding after sex shouldn't be persistent.
How common are labiaplasties, and what is a labiaplasty?
So labiaplasties are probably more commonly done than medically should be done. Everybody wants a perfect vagina, so labiaplasty is really trimming, reshaping the outer lips, the labia. Some want it to look like the latest porn star, because that's what they're often basing it on. And if you think about it, anything in twos is not symmetrical. Your eyes, your breasts, your ears, a man's testicles, things are different. So medically speaking, and not cosmetically, I think it's definitely, there are indications for women that have oversized labia who, can't exercise without having pain, can't have intercourse because the lips get dragged into the vagina. And so we have to sort of look at, really what the reason is, because the perfect vagina is different for everybody, and I would be careful.
Do you recommend for teenagers to get breast reductions if it's posing serious medical threats?
Usually you want to wait for the breast to fully develop, and some plastic surgeons may say wait till 18 or even 21. But for some women that have extra large breasts and they have chronic back pain or neck pain, they can't exercise, they can't fit in clothes well. I mean, it's physically and emotionally, traumatizing. And this is where it can be covered by insurance companies, because it's persistent and it's painful and it doesn't help with your posture or your self-esteem. So it's such a great procedure to have if you really need it.
Can you please explain, just like for the record, the complete anatomy of the vagina, please?
Thank you for asking. I've been dying to talk about this, dying to talk about
Pictures!
this. You have to know you're normal to know what's abnormal. You have to know the layout. This is the external genitalia. We call it the vulva. And there are the labia majora, which are the big lips, and then there are the minora, which are the smaller lips or the inner lips. They all lead up to the clitoris.
Ding, 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 ding.
Yep, which is the magic bell. It's the pleasure zone. It's with its 8,000 nerve fibers, and it's covered by a protective hood. Okay, if you part the labia minora in the middle, you're going to see the vaginal opening. It's also called the introitus. If you go up a little bit, sort of in that 12 o'clock position, there is an opening called the urethra, and that's where the urine comes out. Now, the canal is actually the vagina. Okay, this outer area is vulva, inner is vagina, and that's what leads to the cervix and uterus. So this is your lady parts, as beautiful as it is.
These are your lady parts, ladies. I love that. Should you always pee after sex? And personal question, what if you can't pee after sex? What if you just can't go? What do you do after that?
You should definitely pee after sex. It used to be that you pee before sex. And then we realized that wasn't the case, and that would actually increase your risk of UTIs. So when you pee after sex, what it does is it removes all the bad bacteria that got pushed into the vagina during, sexual intercourse. So when you pee, it gets rid of it. It's really important to make it your routine. Now, if you cannot pee because you just can't do it, and some people have problems doing that, I recommend two things. You either turn on the water and you sit there quietly and peacefully and don't rush, or you sit in a bathtub of warm water and you relax your body that way. And with time, you should be able to pee.
Speaking of UTIs, do you have any at-home remedies to help?
Well, the go-to was always cranberry juice, cranberry tablets. There's other better things like D-mannose and probiotics. If you have a UTI, chances are you're gonna need an antibiotic to treat it.
Can the pull-out method work?
I call that the pull and pray method because it is probably it's the least reliable birth control method out there. The reason it's not so great is because there is something called the pre-ejaculate fluid. And in this pre-ejaculate, there are many viable sperm that can make a woman pregnant. Do not pull and pray.
Endometriosis, what is it? It is so common in women.
Endometriosis is a condition where the tissue that's in the lining of the uterus somehow migrates out into the pelvis. And we call them endometrial implants, and they can be on your ovaries, your fallopian tubes, your bladder, your bowels, anywhere in your pelvis. And every month when you have a period, these little, some are even microscopic implants, they bleed. And that can lead to pelvic pain, and it can happen during sex, it can happen with your period, it can happen when you pee, if you have a bowel movement, causes infertility, ovarian cysts, the list is long. And Sarah, since you suffer from it, it is really, really debilitating.
Yeah, I am on a bunch of different types of medications for it. Because I have endometriosis, I've been thinking about egg/embryo, still not sure, freezing. When is the best time to do that? Why do you think we should freeze our eggs as women? Let's talk a little about eggs.
One of my favorite topics. It used to be family planning was about preventing pregnancy with birth control. Well, now family planning is really about egg freezing and preserving your genetics. And the best time to do it is anywhere between 31 and 38. But it is such a great way to family plan for the future. I highly recommend it. And I think in your early 30s, you and your healthcare provider should really start talking about it.
That was so much fun. Thank you so much, Dr. Sherry.
Bye, Sarah.